there's nothing to breathe.
Healthy Heart, Happy Life. It's a new segment that we're launching here, and Dr. Morbia joins us, and he's going to tell us all about making sure that you do have a healthy heart so you can have a happy life. Thank you so much for joining us.
Well, obviously, healthy heart is very, very important because, as we all know, that heart attack and stroke is the #1 killer in our country, and both are preventable, the stroke and the heart attack. Then both are caused usually by the blockages. There are other causes for it, but blockages are the usual cause. And there can be blood clot, there can be bleeding in the head, that can cause stroke also. So what we like to do is we like to prevent it as much as possible, rather than have it and then try to take care of it. And we can take care of it when it happens, but I would rather prevent it. And how do you prevent it? A healthy lifestyle, very important. It's not an easy thing to do. It's a commitment that we have to make. It's a lifestyle change. It's a lifelong change. It's not a temporary fad diet or, I call it common sense diet. You have to be careful in what you eat. Any kind of fatty, oily, greasy, cholesterol foods, try to minimize it or avoid it as much as possible. Fried foods, we all like that, but it's better to minimize it and be smart about it. Even the sugaries, candy, the food with a lot of calories, the less you eat, the better off you are. You should enjoy it. We're human beings, and we should enjoy life. We should not be eat boring foods all the time. But comfort foods are for comfort, and they should not be. We should not gorge on them. At the same time, salads without fatty dressings, lots of vegetables without fatty dips, some fruits, but fruits have calories too, so you have to be careful. If you do all that and any other food, get the fat out of there as much as possible, and rather than frying, maybe bake, and things like that. If you do things like that and try to eat healthy, what you can do long term, you can have clean arteries inside. If you have clean arteries inside, you may not get a heart attack, and you may not get blockages, you may not get a stroke. But at the same time, exercise, we should not forget exercise. Exercise is very, very important. Minimizers can do 20, 30 minutes 3 times a week, but I recommend more than that. You can build up to that. You don't have to start doing that all in one day, but gradually you should at least go up to 5, maybe 6 days a week, anywhere from 30 to 45 minutes, a little bit longer than that.
And I know that we've been talking about heart blockage. Talk a little bit about this machine and what role that it plays in helping a patient that has had a heart attack or had some blockage.
Well, this machine basically is a wonderful machine. It's an expensive machine, but it does a good job. Mm-hmm. What it does, it helps us find the blockages. And the way we do it is, say if a blockage is in the heart arteries, mm-hmm. we can go from either the groin or the wrist or the elbow into the heart with little catheters, tiny little catheters through IV. We don't even use the knife. It's all through the needles and the catheters. Mm-hmm. And they're basically 1.5 millimeters to 2 millimeters diameter. And we do all the work through that. So we go all the way to the heart, and we inject a little dye and take a picture. If there's a blockage, it's going to show the blockage. Once you see the blockage, say if you need to fix the blockage, all you do is put a little guide wire through it and bring your balloon or stent, which stent is on the balloon anyhow. You bring it at the blockage, and you position it around the blockage, and you open it with the balloon. You inflate the balloon. When you inflate the balloon, the blockage gets pushed to the wall, and when you deflate the balloon, the stent stays in place and keeps the blockage open, and you take the balloon out, you take the wire out, you take the catheter out, and all you're left in there is a stent with no blockage. You can have 100% blockage or 99% blockage or 95% blockage. When you're done, it's 0% blockage.
Wow, that's awesome. Now talk a little bit too about what kind of process that this takes. I mean, is it an hour? Does the patient get to go home the same day? How exactly does that work?
Well, as you can see, this is in our office. Mm-hmm. So we don't have overnight stay here. So everybody who gets done over here goes home the same day. In a few hours, as a matter of fact. It doesn't even take that long. Theoretically, no, not theoretically, practically, on a daily basis. Say a patient comes in at 5:15 in the morning. That's when our usual first 2 patients come in at 5:15 in the morning. And when they come in about 6:15, it takes about an hour to get them ready. So we start our first case at 6:15. And say if we do the heart cath, we find a blockage, we fix the blockage. By 7 o'clock, you're done. Or maybe 7:15, depending upon, how complicated the case is. Well, the patient goes to the recovery room for the next 3 to 4 hours, and before 10, 11 o'clock, the patient is home. So a patient can come in with 99% blockage and be home with 0% blockage before 10 o'clock in the morning on the same day.
Wow.
No overnight stay, and and this is the way it goes almost 100% of times.
That's great to know. And of course, that goes back to what we've been saying, that a healthy heart, a happy life. We'll be right back after the break.